Welcome to this special Gastro Girl podcast. This episode was produced in collaboration with the American College of Gastroenterology's Patient Care Committee. Here's your host, Jacqueline Gaulin.
Hey everyone, welcome to the Gastro Girl podcast. This is a special episode that's produced in collaboration with the American College of Gastroenterology's Patient Care Committee. And today we're so fortunate to be joined by one of the members of the Patient Care Committee, Dr. Matt Hoscheit, who's a gastroenterologist at the Cleveland Clinic. And he works alongside another one of our esteemed guests that we had a few episodes ago, Dr. Scott Gabbard, very interested in functional GI disorders, swallowing disorders, constipation, and just he's so interesting, and we're so blessed to have him on the podcast today. Welcome, Dr. Hoscheit. So happy to speak to you today.
Jackie, thanks so much for having me. It's a pleasure to be coming at you from Cleveland. I know I have big shoes to fill with a lot of the other guests that you've had on the podcast, but I'm really happy, really excited to be here. So I appreciate your time.
Oh, and we're going to tell our guests what we're talking about today, Dr. Hoscheit. We're talking about cyclic vomiting syndrome. Now, it may sound a little weird, but this is a really interesting topic. It could have a number of causes. Why don't you tell us what cyclic vomiting syndrome is?
Great question. I think it's an important place to start. And I think it's one that's important to talk about when it comes to gastroenterology. There's so many fun topics to talk about within the field. And I think this is one that is common. It's underrecognized, underappreciated, and I think sometimes underdiagnosed and missed. And so what it entails, when we think about cyclic vomiting syndrome, we use a definition that's very common. There was this something called the Rome Foundation, which was a conference that originates in Rome when everyone gets together and they sort of put definitions to different things within our field. I think it's important because it's they set the standard for what issues in GI we deal with, how we recognize them, and how we sort of talk about them with one another. And so when you think about cyclic vomiting syndrome and you look at the way they define it, the name is pretty descriptive. So it sort of describes a diagnosis in which someone may struggle with episodes throughout their life. It can be as few as 3 a year. It could be up to the hundreds every year, where someone has these severe debilitating episodes of recurrent nausea and vomiting. They feel miserable. They're bedbound. They're at home. Can't keep anything down for days at a time, interspersed with these periods of time when they feel completely normal. People are able to work. They're able to socialize, be with their families, eat whatever they want, and enjoy their hobbies and interests. And so it sets them up for this interesting sort of practice throughout their life where they're always wondering, when's the other shoe going to drop? I'm feeling great right now, but I don't want to take a vacation. I don't want to go to work. I don't want to go to church and be with family and friends, because they live in this sort of fear of when the next episode is going to occur. And it's so important to recognize that and talk about it.
No, I'm so glad that we're speaking about this today. So it raises awareness. People may not even realize what this is and that it could be diagnosed and hopefully treated. But how common is cyclic vomiting syndrome? And does it affect more men than women, adults or children? Like what do we need to know about this?
I think it's important to talk about that. So 2 ways I think about cyclic vomiting syndrome in kids and in adults. Pediatric gastroenterologists, time and time again, have been proven to be a whole lot better at recognizing it than adult gastroenterologists. And so a lot of the data that we have stems from pediatric studies. Your child is really sick at home, you're a whole lot more likely to take them to the doctor and really sort of drive after answers, being a father myself. And so I think it's more easily diagnosed. It's diagnosed quicker in children than it is in adults. And so looking at that data, where you look, it could be 0.05% of the population up to 2 to 3% of the population, depending on what you read. And if you're going to look at the upper end of that, 2 to 3%, that actually makes it a little bit more prevalent and common than some of the things we're really familiar with, like celiac disease. And so I think that really puts it in perspective about how much of it is out there. So it's important to recognize that and think about it early on. Reason is, let's say I'm an adult gastroenterologist. The studies show it may take someone up to 8 years of struggling with these symptoms to get diagnosed, which it's hard to think about that someone would struggle with that so much. Tends to affect women a little bit more than men, maybe 1.5 times more often than men. That's in children, adults. We don't quite know who's affected more.
This is so interesting. And I really am interested. It found your point about we take our kids to the doctors quicker and probably more promptly. And then adults, we just kind of suck it up until we can't take it anymore. And then we get ourselves to care. But what are the symptoms of cyclic vomiting syndrome that we should be aware of? To maybe someone's listening out there and they see that, oh my God, this could be me or my child. Like, what are some of the symptoms?
The interesting thing about it is a lot of people follow a common path, but everyone's story is a little bit different. That's what I think it makes it so interesting and so important to think about. I try and sort of break cyclic vomiting syndrome into 4 stages, I guess, for that matter. First stage is where everyone wants to be, which is what we call the symptom-free phase. Feeling good, nothing can slow you down. You're eating whatever you want. You're going to work. You're enjoying your time. There comes a time, what we call the prodrome phase, where subtle symptoms start to creep in that sort of bring up a red flag that something may be going wrong. And that's sort of the tricky part because everyone's prodrome phase is different. The most common thing people run into is run-of-the-mill nausea. So you sort of get that sense, and that's pretty common, right? Got nausea, it stands to reason it may lead to vomiting. I need to be aware of this. However, it can really range in studies that have looked at it. Some people will just sweat profusely, which I think is interesting. Some people will have changes in their bowel habits. Some people will have changes in their mood. They can become irritable or maybe a little bit of brain fog. And so it is quite different for everybody. It's really important to think about that when you're going through this, if you're going through this, because it makes a huge difference in how we intervene and prevent these episodes from happening in the first place. The next stage is the stage that's really hard. That's the stage of vomiting. Those are the times where you're laid up in bed, you're having difficulty, you're throwing up a lot. You may have to seek medical attention if it gets that severe, and that's something we see quite often. 4th stage is when you're coming down off that, when you're feeling well, you're sort of going home. If you're in the hospital or the emergency department, your symptoms are returning back to normal. The stages can vary from person to person. The length of time you can spend vomiting, you can spend sick, can be as short as a few hours. It can be up to a week. And so again, it's a different flavor for everybody. It's important to recognize that those variabilities exist because a lot of times that's the reason that this gets overlooked.
So what are some of the causes? Now, there's so many, I don't want to make assumptions here, and correct me if I'm wrong, but there are several GI conditions that have nausea and vomiting as a symptom, right?
Yep.
And now we've read a lot about there's gastroparesis, but we're hearing more and more about gastroparesis because of those weight loss drugs, right? And there's no motility in the stomach. I find this fascinating. The stomach has slowed the motility, and people have almost this kind of episodic pattern of nausea, vomiting, sweating, not being able to eat. And it's very interesting to see the connections for this. Absolutely. And I don't want to take us down a path that's not about the topic, but I just, as a patient myself and very attuned to the patient journey from talking to other patients, what are some of the causes of this syndrome?
Yeah, a lot to unpack right there, a lot of talk about. I will make a side note that my wife is an endocrinologist, and so when it comes to these weight loss drugs, we get in a lot of heated discussions over the dinner table about what side of the fence we need to be on with these, and we certainly have different perspectives. And then you talked about how there are so many different things within gastroenterology that can mimic or mirror cyclic vomiting syndrome. And like I touched on the Rome Foundation, they're very good at breaking these things down. So the way I think about it as well, with cyclic vomiting, you have periods of time where you're feeling good. For folks with gastroparesis, functional dyspepsia, chronic nausea, and vomiting syndrome, which are all different entities within our field, those all feel different. And I will tell you that individuals with all the things I just mentioned may have more bad days than good. And with cyclic vomiting, it's generally the opposite. And so to parse those things out, it is so important just to kind of sit back and talk to your doctor. Flush out your symptoms. Here's what I'm going through in detail. Let them ask a lot of questions. I think just having that initial discussion in your first visit is so important because that's where this can really be identified. And all the other things that you're worried about may fall to the wayside.
Can you just have cyclic vomiting syndrome with no cause? You just happen to have this, or is there something related? Like we talk about, it could be a gut-brain axis issue. It could be imbalances in our nervous system. It could be headaches, right? Migraines. And I know there's other things genetic related that could be causing this. And then we hear about the weight loss drugs now more and more. And then we talked about overuse of cannabinoids, right? Marijuana use could also be involved. So I guess I'm trying to get to, and maybe we'll get to this in the diagnosis part, but how do you know if it's just, you just have this or if it's related to something else? And what would a patient need to do? And I know you said talk to your doctor, but be aware of to get to the right diagnosis, and how is this really diagnosed? And do they, so absolutely. I can go on and on with my questions. It's so long.
They're all fantastic questions. I think we gotta get to all of them. The unfulfilling answer is all of the above. And so you ask 10 people about what causes cyclic vomiting syndrome, you may get 10 answers. And there are so many different theorized mechanisms of why this happens. You mentioned the gut-brain axis, and we're so great about talking about the gut-brain axis, but you get down to what is the actual science of the gut-brain axis? Gets a little murky at that point because there's so much we don't understand about how the body works. That owner's manual is much shorter than it should be. And so when I think about cyclic vomiting syndrome, and we'll get to medications and marijuana and things like that, but there are times where some people just get dealt a bad hand and they've done nothing to sort of promote this or prompt this. And I try and break it down to 4 mechanisms of why this might be, because I can't count much higher than that. I think the first is it absolutely can be a genetic reason for why people get cyclic vomiting. One of the mechanisms that's theorized is that everyone's learned in science class that the mitochondria is the powerhouse of the cell. It's this little organ we have in every cell in our body, and it produces energy that we need to survive. And it's supposed to function like a well-oiled machine. And there are genetic reasons for folks with cyclic vomiting syndrome that mechanism doesn't work as well as it should. And the energy that's produced is not right, it's not done well, and it's done lesser than it should be. And so there can be vitamin deficiencies that occur, and that decreased energy production can actually cause GI symptoms. So that's one of the mechanisms of why that might happen. Another that we think is probably there is some link to migraines and the way that happens in the brain. The reason is about 1/4 to 3/4 of people with cyclic vomiting syndrome, they either have a personal history of migraines that they're seeing a doctor for right now, or they got someone in the family. And so when I think about this, I ask them that question because they are 3 times more likely to have migraines than the average individual that does not have cyclic vomiting syndrome. So it's so much more common. The other reason we think there's a link is that anti-migraine medications seem to work. We can give people things like sumatriptan, or better known by the brand name Imitrex, and that can cause people to sort of snap out of their cyclic vomiting episodes. And it seems odd. So we think there's probably a link there as well. Environment has to do a lot with it, and that's hard to pinpoint down for a lot of people. If people experience stress or trauma growing up as a child, they're going through a stressful time in life, be it personal, professional, or otherwise, those have been linked to cyclic vomiting as well. And then the last is probably some form of neurohormone imbalance. We talk a lot about neuroendocrine and autonomic dysfunction. We know these people have alterations in their blood pressure and heart rate that are different than what's expected. We know their GI system probably doesn't work at the same pace as other people's. Their stomach digestion doesn't work in the way we would typically expect. And so those are some of the 4 things I think about that may be inherent to someone's biology for why that might occur. Now, you talk about things outside, the hot topic is marijuana and weight loss drugs too. And we tend to recognize cannabinoid hyperemesis syndrome differently than cyclic vomiting syndrome. The only difference is the presence of someone uses marijuana recreationally or medically. And so that is a very common issue that can be dealt with. To give you the perfect example, someone studied the rate of cyclic vomiting syndrome in Colorado when they legalized marijuana. The rate doubled. And so,
oh, wow.
Yeah. And so it really speaks to how prevalent that is. And a lot of people will say, well, marijuana helps me, actually. It helps with my nausea, but you may see it with other people. We don't know who's going to respond beneficially with it or going to have a negative impact. We just have no way of predicting that. And so it would be a tough conversation to have with people and try and figure out, well, what exactly is causing those things? Then you look at someone's medication list. Pain medications are known to affect the GI tract in negative ways, so that can cause it too. And then these weight loss medications that are out that are phenomenal for weight loss and diabetes and blood sugar control. But the reason they work so well is because they kind of jam up and slow down your gut. And that can lead to a lot of symptoms that sort of mimic cyclic vomiting syndrome as well.
This is such a fascinating topic. I mean, it really is.
Yeah.
It really, really is. And we may have touched on this a little bit, but what are the triggers? What could trigger? Is it environmental? Is it food related? Like, what would you tell patients if they say, well, doc, what's triggering this? I don't understand.
Again, it's all of the above. And so, you start with diet. There are some common things and they differ for everybody, but I always ask, alcohol use is a very common one. And so people will say, well, when I have a drink, I may have an episode. And so it's important to recognize that. And then foods can vary from individual to individual. You hear a lot about cheeses and red wines and things like that. So is there something there that could be contributing to their episodes? And then it may vary from individual to individual. Red meat, something that's tough to digest, can give people problems sometimes. So a lot of times when it comes to food, it takes a while. You got to see someone 3, 4, 5 times, have them keep a diary, and eventually maybe it starts to parse itself out. Environment can cause a lot of it too. So see a lot of people who are in high stress jobs, lawyers and whatnot, that can cause it. If you got a tough case in the legal world, that can flare it. And then sleep deprivation is a big one too. So people who have kids, which hard to deal with that. People who work the third shift overnights. And so when your sleep schedule is altered, that is a very common trigger for cyclic vomiting episodes as well. There seems to be some association with seasons. So if the winter months can flare them, we're not quite sure why that is. Does it have to do with sunlight, vitamin D production? We don't quite know. And then other health issues too. If someone goes through another health issue like an infection, it could be sinuses, urinary tract infection, what have you. Those are also very common reasons that people can get episodes. I think one of the most interesting reasons people can get episodes is swings in emotion on either end of the spectrum. So I've had folks that go to weddings and they are having a phenomenal time, really happy for the bride and groom. They get an episode. And so that overwhelming sense of happiness and vice versa, overwhelming sense of negative emotion can be a very difficult thing for people to struggle with. And that's another reason they can get flares too. So it's tricky.
Oh, wow. So it's not from all that spinning on the dance floor. There's actually
I never ask them about their dance moves, but that could be a very possible reason too.
Well, but in all seriousness, before we get into the diagnosis, obviously when we have vomiting and we have continuous vomiting, it could lead to some serious complications. Mm-hmm. This is why we really want to raise awareness of this topic, because it's not just you're throwing up and, okay, just deal with it. There can be some serious complications. So would you mind just kindly telling us what are some of those complications that could result from this cyclic vomiting syndrome?
Absolutely. I think first and foremost, for people that have a lot of flares, the negative health effects are obvious. These individuals can be losing weight. They can be malnourished, dehydrated. Repetitive vomiting, as everyone knows, is not something that we want to take lightly. Can cause a lot of damage to the esophagus from acid reflux, can cause tears in the digestive tract, which can lead to life-threatening bleeding. And so it's really important to identify those things in a hurry, because you got to intervene quickly in those circumstances. You look at the social effects as well. 1/3 of people with cyclic vomiting syndrome are going to go on disability at some point in their life. They're not going to be able to hold down jobs, have a social life. They can get a little bit of agoraphobia, fear of going out in public, just because they're worried about these issues. And that can take a really big toll on someone. We already talked about stress being a trigger for cyclic vomiting. Well, it causes its own stress. And so the effects socially and medically are profound.
And our teeth, right? All that acid on our teeth is not good either.
You're not going to be your dentist's favorite patient. The acid that you vomit can erode enamel. It can cause cavities, a lot of pain in the mouth and gum erosion. And that's important to recognize as well.
Okay, now we want to know how is this diagnosed and what kind of testing is involved?
Yeah. Testing is going to center around making sure you don't have other things. There's no confirmatory test for cyclic vomiting syndrome. Again, why this is tricky. You got to have a good old fashioned conversation with the healthcare provider and find someone who really wants to listen to you, hear your story, because that's where this gets borne out. Generally, it's recommended if you're concerned about cyclic vomiting syndrome that you have something called an upper endoscopy. It's a test that's done under sedation where you visualize the upper digestive tract of the stomach, making sure you don't have anything like ulcers, tumors, cancers, or any blockages of the digestive tract. It's really important. Also recommending blood work, looking for any sort of metabolic abnormalities. Electrolyte deficiencies can cause vomiting too, so it's important to recognize that. And then being open about things you're using that may not be on your medication list. We sort of do that in the form of a blood or drug screen through the urine, just to identify anything that may be causing this. A lot of people take things that they think, you know what, this was prescribed by a doctor. I was told it's good for me for another medical reason. But as we've talked about with weight loss drugs, a lot of the GI side effects of these things are difficult. Imaging with a CT scan can be important to look at things throughout the abdomen that may trigger this. If it's really severe, sometimes I'll get imaging of someone's noggin just to make sure they don't have anything in the brain, because the brain has our vomiting center there. So we got to make sure that's in good shape as well.
No, I think I missed this when I introduced you, but you're also an expert in your focus area is neurogastroenterology, which I find extremely interesting because it's all about the connection between our gut and our brain. And there's so many things that affect and have this cause and effect on this, and it's just fascinating. So when you talk about those connections, what could go wrong? What are some of the things that, in your experience with patients, that you may discovered with this connection that could lead to have this cyclic vomiting syndrome?
Well, the whole reason why cyclic vomiting occurs centers around this, and the field of neurogastroenterology has been around for a little while. I mean, you've had folks on this podcast that have championed it: Brian Lacey, Dr. William Shea. All these folks are leaders in the field, and they've done such excellent work, sort of trying to look into why this connection can go wrong in people, and there's still so much we have to learn. I think the connection with the neuro-GI tract and the gut-brain connection, it's exemplified in the way we treat cyclic vomiting. And so we know there are hormonal or neurochemical differences in these individuals. Again, it's not something that people are doing intentionally. There's something inherently off about the nervous system, the vomiting center, which we carry back in our brainstem. We know misbehaves in individuals with cyclic vomiting syndrome. And so migraine therapies, a lot of these antidepressant therapies, which we refer to as neuromodulators because we use them for the gut specifically, they are so effective in cyclic vomiting syndrome. So the link is clearly there.
Now, in terms of treatment, my mind always goes to, the GI psychology is really becoming very, I don't want to say normalized, but it's becoming a part of the multidisciplinary care approach to treating GI conditions, which is great. So when we talk about treatment, can some of those, like for IBS, gut-directed hypnotherapy and things like that, stress reduction, diaphragmatic breathing, can those, as we talk about treatment options, would that be an approach that some doctors would take with patients, or are there other medications that we would take to treat this?
I always joke with people that I think everyone, regardless of how well your GI tract works, you need a GI psychologist. They are the true miracle workers in our field. And it is amazing how many people benefit from that. To my knowledge, I'm not sure if GI psychology and gut-directed hypnotherapy have been specifically studied, although I do send a lot of the people I see to our psychologists in Cleveland because they do a great job. And we know that GI symptoms across the board reduce with stress reduction interventions. Like we talked about, a lot of the anxiety and stress that originates from cyclic vomiting, those folks can benefit for that reason. As far as treatment, you're getting into a really broad conversation because it is such a sort of overriding reason for why people get this. You need the involvement of a lot of different caregivers. People need to change their lifestyle sometimes if that's why they're struggling with this. And so it becomes a really long conversation about how we intervene. So, I think first and foremost, you sit down and talk with people and say, well, we talked about the dance floor and the third shift job and the kids, and well, you can't kick your kids out, but what's going on in your life that maybe we can modify and try and prevent? If we can identify a food item or a beverage that's causing your symptoms, is there any way you can transition your work schedule while the sun's up? I mean, these are difficult conversations to have, but really important things to identify, because if you don't nail them, people can really struggle for a while.
Yeah. And I think this is worthy of another episode just focused on treatment options. But I think what we want to do here in this, with what time we have, is to give patients hope that if you have this and you're feeling symptoms of this, there are options out there, right? We're just not going to tell you, if you have this and you're on your own and good luck. I mean, we really want to educate and give hope, and there's options. So would you say what would you tell patients who may be listening to this and think, oh my God, I think I may have this, or my loved one or my child? Like, what would you say to them about the prognosis and treatment options out there?
They're effective. What I tell people is, this has been a wild ride and you've been struggling. And if we can stick it out together for a little while, I think I can get you significantly better if you truly have cyclic vomiting syndrome. So I'll just throw two really common treatments out that I talk about with everybody I see. The first is a medication, or a class of medications that we refer to as tricyclic antidepressants. I tell everyone, I'm not interested in treating your depression or anxiety. That's not why we're having this conversation. It is not in your head. It's a little bit in your head, but for a legitimate reason, right? And so there have been multiple studies that have looked at the use of these medications in people with cyclic vomiting syndrome, and the outcomes are fantastic. So about 80% of people who take them have a substantial reduction in the number of episodes, the length of episodes, and the time they need to go to the emergency department for them. 20% of people who take them will go into complete remission. And so you look at that in and of itself and say, there's a study, I think in 2005, you take someone who goes to the hospital 15 times a year for this issue. 2 years later, they may go 4 or 3. And that is awesome in my mind. You can't nip it in the bud completely, but that is a pretty substantial reduction in these symptoms. Another one I talk about with everyone is an over-the-counter supplement called CoQ10, or coenzyme Q. Everyone's familiar with it for a variety of reasons. CoQ10 sort of harkens back to the mitochondria that we talked about. So it is a supplement that they are deficient in. We just talked about how beneficial tricyclic antidepressants are. CoQ10 is equally as effective in a lot of studies. And whereas about half of people who take the tricyclics have side effects, that many people who take CoQ10 generally have side effects. It is wildly well tolerated. It is effective. And so that alone, you're talking about two medications that are about 70 to 80% effective. And so you've got an excellent opportunity to try some things with folks and get them better, get them back on the right track. So I think the hardest part about cyclic vomiting is recognition. And once you've done that, you're really in a good seat to really work on things and get someone feeling better. And it's just one of the greatest things to check in with someone 2 months after you see them the first time and they are just rocking and rolling. It's fantastic. I'll tell a story if we have time. I saw a guy, probably a year and a half ago, like a month into my first job. I was just out of fellowship. I'm just so green. And this gentleman, one of the sort of the quick fixes for cyclic vomiting syndrome is hot showers. It's a very common thing. And this guy took it to the extreme. He would boil pots of water like you would for your pasta, and he would pour it down his back.
Oh my God.
Right? And he would do it 4 to 5 times a day, and his significant other would do it. And I'm looking at her, I go, what are you doing? And he's showing me his back, and it just looks awful, and he's seeing dermatology. And so we get him on some treatment. I see him 6 months later, and I've seen him in between. And he's gone from boiling pots of water 5 times a day to once in 6 months. His skin's healed. He looks great. And it's just the best. It's just such a great conversation to have with people. So it's recognizable. It's treatable. You can really give someone their quality of life back. And it's just so fantastic to see that happen.
Oh, I love this. So before we go, we're not advocating people go run out and get cute. What is that? Cute.
Oh, Q10. No.
Yeah. But I want to ask this next question because I think this is going to be really helpful. At least I hope it's going to be really helpful for our listeners.
Yeah.
We have listeners out there and they're thinking, okay, I want to see if I have this. What questions should they ask their healthcare provider? They're going to go into an appointment. They want to get this addressed. They want to get on the right path. What are some of the things they need to ask their healthcare provider unless they prepare for their visit?
Do you think I have it? I think that, someone who has listened to this podcast, their symptoms fit, just go ask your doctor. Do you think I fit the role? Go see a gastroenterologist who's familiar with it. Just sit down and say, look, I have been struggling. I really want to talk about my symptoms. Do you have time to hear me out and lay out your story? I think 80% of it is right there. And if someone's familiar with it, or you want to mention, hey, I think I have this. I love when people come in and say, I think I might have cyclic vomiting syndrome. Oh, great. Let's figure out if you do or don't. Sometimes the proof's in the pudding. You'll put people on these treatments. They improve. Great. You got your answer. If they don't, well, we got to rethink what's going on here. And so the questions you have is, well, does the pattern I have fit the diagnosis? Is there anything I'm doing wrong or anything in my medication or personal history that may be a risk factor for this? And it's just something to continue to have the conversation about.
One last question. This is so fascinating, this whole conversation. I really appreciate it. But when should a patient or when should someone contact or visit the ER if they're experiencing these symptoms of cyclic vomiting syndrome?
Yeah, I tell people a few things. First and foremost, listen to your body. Some people just have that internal switch when it just sets in, hey, I need to go. Don't fight that urge. Go. I think from my perspective, what I tell people is if you cannot keep down fluids, if you can't keep down water, Gatorade, Pedialyte, whatever electrolyte solutions you have, you may start to venture into the area of dehydration when it becomes harmful. And I think at that point, it's really time to go see a healthcare professional and in a hurry. At the same time, if people are having crushing migraines with these episodes, you're having visual issues, that points to the need to see someone in a hurry. And then if you're having vomiting, there's blood in your vomit, there's signs that the GI tract is misbehaving, again, it's time to go talk with somebody. And so I encourage people, have a low threshold, take care of yourself, make sure you're doing right by you and listen to your body. I think those are some of the important things.
Well, this has been fantastic. And I really do want to have you on for a part 2, because I think we need to dig a little deeper and give folks some insight on, living with this and some of the treatment options in a little more depth. But this has been just so informative. Dr. Hoscheit, thank you so very much. I hope to see you again. And I'd like to thank the American College of Gastroenterology's Patient Care Committee for this great topic suggestion and this amazing guest. Thank you so much. Don't forget to subscribe and share from your favorite podcasting platform as well as YouTube. Thank you so much.
Thank you.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.